Good morning, everybody. Welcome to episode 20 of Digital Health on Air. My name is Aditya. I'm one of the founders and CTO here at Luma Health. Today, we're going to be talking with Chris from Permian Regional Medical Center to talk about patient readiness and the key to better care. Chris, welcome to Digital Health on Air.
Thank you for having me.
So, Chris, I'd love for our audience here on DHOA to just learn a little bit more about you. You've been at Andrews Family Medicine and Permian Regional for a while now, but would love to understand a little bit your path and how you got there. We'll use that as a kickoff for kind of a fun conversation this afternoon.
So I was at LPN for 16 years, worked on the floor, graduated with my RN, and as soon as I got my bachelor's degree, a recruiter called me and asked me if I wanted to work in IT. I was helping support Meditech. I said, well, not something I thought I was going to die a floor nurse, So went and interviewed and everything worked out there, worked for them for 4 years. Then I started consulting, helping implement ambulatory Meditech across mostly the Midwest. Did that for about 4 years. Came down here to Andrews on an EHR project. Looked like they weren't going to need me. They just had some turnover as their office manager had retired. And they asked if I would fill in. And I said, well, you're paying me. I'll do whatever you want. So did that for several weeks, and then they offered me the full-time position, and talked to my wife about it. And, that was like right during COVID. It was May of 2020.
Oh, so more recent kind of, yeah.
Yeah, been about 4 years. And so when we first came down here, we brought our camper. They let us stay here on the hospital grounds, and we kind of fell in love with the small town. So my wife and I talked about it, and we decided to make the move down here. So we've been here about 4 years.
That's awesome. And so for folks, I'm in Dallas, Texas, Permian, Chris, you were telling me in the pre-chat, you're closer to New Mexico than you are to any Texas, like big city in Texas, but, stone's throw away in your line, only 6 hours to get to Dallas for you.
Exactly. Yes. So yeah, we're West Texas. We're about 40 miles north of Midland, Odessa, about 100 miles south of Lubbock.
Okay. So tell us, tell us a little bit more about, Andrews Family Medicine, Permian Regional Medical Center. You've been there for 4 or 5 years. You probably have a very specific kind of service area, Permian Basin. Tell us a little bit more about, your patients and who you service.
For sure. Well, first, we strive to live by our mission here, which is serving the patients and communities with exceptional healthcare and a compassionate and healing environment. So Andrews Family Medicine is a rural health clinic, which is hospital owned by Permian Regional. We have 14 total providers, 6 are family practice and OB. We have 2 general surgeons, 4 nurse practitioners, an OBGYN, a podiatrist, and a part-time urologist who just started back in June.
Oh, nice.
And we take great pride in our hospital out here, and we're dedicated to providing quality health care close to home.
And in your provider group, of the folks in Andrews Family and kind of in the broader hospital context, do you also have a fair number of traveling physicians as well coming in, like orthos or anyone else, or is it only just your own physicians, employed physicians?
Just at Andrews Family Medicine, we only have our physicians. We do have a second RHC in town. That's a walk-in clinic only, and they do rent some space out to other physicians. So we have some cardiology groups that come up, an ortho and a neurologist. I think they'll come up from Midland, but maybe like 1 day a month. So.
Got it. Oh, okay. No, it makes sense. And, it's a fairly, for your community, tell us a little bit more about the patients. Are they farm working, kind of Permian? You always think about oil rigs and that sort of stuff. Tell us a little bit more about who comes for service at your locations.
Yeah, it's really a mix of everything that you'd see in any big city, quite honestly. We are located in the heart of oil country, so we have a lot of workers who are here temporarily. So we have, patients that'll just be traveling through, but our main patient base is located here in the town, and it's a great mix of elderly all the way down to pediatric newborn patients.
Yeah, that's fantastic. So let's talk about getting patients ready for care. For us, I think at Luma and kind of what I see working with healthcare leaders, there's a really big step between getting the patients scheduled and making sure they arrive. Does that resonate with you either as kind of the provider's new role, your role as a clinic director? Tell me a little bit more about how getting patients ready for care kind of comes to life for you guys at the both the hospital and the ambulatory locations.
For sure. So we're real fortunate here to have such a supportive leadership team that see the same vision that most of us directors do, where we want to, use the new technology that's out there and not rely on old processes. So when I came here a little over 4 years ago, there were so many processes that were still captured manually, either on paper or by phone calls. And it's just inefficient to do it that way. It takes so much time. And there was a stigma attached to our town for whatever reason that they weren't going to adopt the technology updates because we're, and the majority of our patients, were elderly or older type patients.
Yeah, pretty standard demographic in healthcare, right? More service provided to, older folks. Yeah.
And so we worked really hard to debunk this myth and been very pleased with the adoption of our appointment reminder and as well as the texting platform that we've implemented over the last few years that they can text directly with nursing staff, the patients can. We've recently made a switch to vendors to allow for bidirectional communication within which has been great for us.
Awesome. And that when you think about kind of like the patients, engaging with technology, you think a little bit, you're booking an appointment, but you're saying there was a lot of manual processes that, paper-based processes. So, there's intake and forms that you've had a background as a nurse, there's more than just the forms that need to get ready. Can you talk a little bit more about in that patient's mindset, what has to happen? And really as a clinic director, from your mindset, what has to happen for them to be truly ready for care?
Yep. I think it's extremely important for them to be prepared for their appointments prior to coming to the clinic. If they can complete their medical history, their med list, which sometimes is really extensive.
Sure.
Gather their insurance information before they come so they're not fumbling around and try and find their insurance card when they get here. Make sure they're accurately capturing their current symptoms so they can explain it to their doctor correctly. Instead of feeling rushed when they get here, when we hand them a packet of paper and say, fill this out in 15 minutes, and they're sitting there racking their brains trying to figure out, when was that surgery? No, I know my mom had diabetes, but was she on insulin or was she not? Things like that. It's just really important for them to know all that before they get here, for us to be able to provide care to them as well. And it also provides the ability for patients to share who they really are and what they feel in their own words from the privacy of their own home.
Yes.
I'm likely to be more honest about what's going on with me if I can think about it when I'm sitting on my couch than in an office with 15 other people standing around me while I'm...
Yeah, and I think that's one of the challenges about doing that stuff at home, right? Or, at the office, which is I'm there for a 3 o'clock appointment. If I'm lucky, I got there at 2:50, and I've got 15 minutes of paperwork, and I don't want to be late. Is the doctor going to be late? And it's just that tick-tock, that inside, the waiting room, it's it's sort of in some ways like a really calm boiler room.
For sure. And the frustrating thing to patients too, I think sometimes is they'll fill out the packet or they're in the middle of filling out the packet and they're called back to see the provider. They'll be in the room of the provider and the provider doesn't even look at the packet.
Yes.
Well, it's time figuring.
We've all experienced that.
So why did I spend all this time, getting all this done if you're not even going to look at it? Well, if they can do it beforehand, the provider will review it before instead of after the visit. They always end up reviewing it. They just don't do it right there in front of the patients.
Really interesting question here for you kind of on how to run a good clinic, which is part of it is actually training, not just your patients on how can we, you help us help you a little bit, but also the providers to hey, we're going to get 70% of this prep work ahead of time. Make sure you read it. It's kind of a conversation on both sides, don't you think?
Absolutely. Capturing the information has to come from the patient, but the preparation is all the nursing staff and the provider. They have to be ready. If they're going to see 40 patients in a day, they have to know why the patient's there before they even get into the room. They can't waste time, trying to figure out what the patient's full history is while they're in there with the patient. They should know that already when they get in front of the patient. And then,
honestly, I think anyone as a patient, you see that you're sitting in the lobby, you see the med assistant, and then you see the provider or a nurse in the middle, and you're I've done the same exact thing now 5 times. Tell the check-in staff why you're here, tell the nurse why you're here, tell the doc why you're here. I'm I did this online. Can you just read my reason for visit, and then we can just start working on that. I'm sympathetic on both sides, honestly, as a patient because I've experienced it, but the provider also has to, be trained, but also have the time too, right? And that's part of, I imagine it's part of clinic management.
Absolutely. When you have so many, we see about 200 patients a day here in the clinic. That's, it's a lot.
Yeah, it's a busy clinic. And
yeah,
you said a provider's going to see 40 patients in a day. I'm like, that is a very busy provider you got there.
Yeah. So we have two that see over 40 every day when they're here.
Bless
the rest between 20 and 30. So.
Yeah, that's like a number I hear more normally, but those are some F1 drivers, those providers, they're driving fast. So, one of the things that's kind of hard about this, and we're kind of getting into that part of the conversation around making sure the patients are ready, the providers have read the prep and all that sort of stuff. So a lot of that is like, intake is forms, it's this, it's that. But, I think you're in the process of a Meditech portal upgrade. So you can, patients, I should say, and his family can sign consents, update insurance. Can you talk a little bit more about that initiative, kind of how it's been going? How are you promoting it? Like, I think the Digital Health On Air audience would love to kind of understand a little bit more about how to make that project successful.
For sure. So we started with this project a little over a year ago. It's taken me a long time to get it done, mostly because I'm the one person who's doing it. There's not for us doing it because we're a small facility. So, but Meditech has their patient portal intake solution, which is nice. I've been very pleased with it so far. We are able to do digital consent forms, questionnaires, capture IDs and insurance cards, as well as demographic information before the patient gets here.
That's great.
It's amazing. We just turned it on a week ago because we just finished our upgrade finally. And so I don't have a whole lot of data yet because we're still early in the implementation process of it. But as far as marketing, we put it on our website. We've sent reminders to our patients, letting them know, you'll be getting emails. It only goes out via email, which is, I think, one of the drawbacks to the patient portal. Because our patients are very, very responsive to the text system we have in place. And so we are looking to enhance that with our current appointment reminder vendor as well. And the reason it took us so long to do the patient portal project was we were looking for a third-party vendor who could do bi-directional data and get that information directly back into the EHR as discrete data, as the patient portal does. And so that's why we started it. I think we'll probably go only to the third-party vendor once we get that implemented.
Right.
It's a little easier for the patient to sign in. They don't have to remember a username and password to get into the to the third-party vendor. But for the portal they do. So I don't expect our volume to be very high, but we have had several. I'd say probably 15 patients in the last week that have used it already, which is
that's awesome. I think it's one of those things where, patients want to be good stewards of their healthcare if we provide as healthcare IT professionals good tools and technology to make that happen. And so, what have you found has been kind of the most effective way to get patients ready for care? Like now that you've had a week of experience with the portal?
I'd say this is the best we've had so far because staff can go ahead and there's just a button on the clinical home screen. They can just click it and consume all the data that the patient's already provided, which is great. In the past, we've tried having the nursing staff call new patients prior to their appointment to try and obtain that information, and it's just not efficient and it's super time consuming. We've posted our new patient packet forms online and had patients try and print them out, fill them out before they come in. There's drawbacks to that because patients have to have internet access at home and access to paper and ink and
I haven't owned a printer in probably 8 years. Like, it's funny. My folks were like, "You don't have a printer?" I'm like, "I have a Kinko's. Like, I'm good." Like, it's really 3 times a year I need to print something. That'll work for me.
Exactly. And so, since we tried those few things, we ended up just reverting back to our old paper process. And, I get complaints at least once a week from patients. Why do I have to continue to fill this out? I did this last time I was here. I'd much rather do it before I even come. That kind of stuff. So we're really excited about the new technology that's out there and ready to get it going.
So you hinted at something kind of when you were talking a moment ago, which is, used to have like nurses or front office staff call patients. So folks are, in any healthcare organization, folks are on the phone a lot, right? The phone is like a really important part of, the TikTok, the metronome of how healthcare runs. Would love to just kind of hear from you a little bit about, what is your staff doing on the phone lines? What consumes their time on that now that some of this new technology is in place? Like, how has the time shifted of what the front desk staff does?
Yep. So now that we're looking at freeing them up from having to answer the phone so much. Previously, what we also did is we hired a scheduler, and we got a second phone line for the clinic. So we have our main number, which you have an operator for, and then we have a scheduler, and she's dedicated only to patient appointments. So that's freed up the front office staff.
And that's an incoming call, like a single dedicated. Oh, wow. Okay. That's a big commitment to incoming scheduling.
Exactly. But that required a whole full-time person to employ.
Yeah, oh, for sure. Yeah. It's like commitment in all senses of the word. Yeah.
It's expensive. But it has decreased some of the phone volume for the front office staff. I'm looking to really decrease it by at least 50%, if not more, with this digital intake solution. So I won't have numbers for a while, of course, but that's the hope, because really what I want the front office staff to focus on is taking care of the patient center right there in front of them.
Yep.
There's no need for there to be a line, patients waiting to check in just because they're on the phone trying to schedule a patient, when we have other solutions available.
Yeah, we can do better than like the DMV, right? Like we don't have to kick a ticket. We should see them where they need to be seen. So, I think one of the areas you were focusing on was like all this data discreetly landing in Meditech and your EHR, kind of pulling all those pieces together. So how important it is for you, both from like the clinical side, the operations side, that everything communicates directly over to your Expanse instance? Of course, it's obvious that it's important, but kind of tell us a little bit more, because I think you've made decisions in how you run your operations based on those factors.
Absolutely. In my opinion, it's vital that any third-party system we use is capable of bidirectional integration with our EHR. If any information that's captured outside of the EHR and still requires any kind of manual input to get the information back in, is really no better than paper, in my opinion. You can other intake solutions that are out there, the patient will fill it out and you can import that as a PDF. Great. Yeah, but then it still has to
someone's got to copy and paste from the PDF into the right spot. Yeah.
Put it into the visit note, and fill in the patient's history and all that. So it saves so much time. It's so much more accurate. And I feel like it's a lot easier for the patients too.
Yeah. And so one of the other parts I think when I think about like readiness is not just like intake, but there's other parts around like insurance eligibility, verification, payments, that sort of stuff. So where is your head on kind of like, we got intake as like the hub, and there's all these spokes that connect to it. Where's your head on kind of how you evolve the technology and the patient experience, right? On the other pieces, like let's maybe take insurance bits like eligibility and verification and payments as the specifics there.
Yep. So prior to my arrival here, we were doing manual insurance verifications still.
Like manually, like picking up the phone, like calling the
phone and calling, or going to the payer website. And then we do have a clearinghouse that they could go to, and it did, maybe a dozen or so of our payers, but there was a ton that were still doing all kinds of different convoluted processes. And quite honestly, the staff wasn't really doing it,
sure,
because it was so complicated. Yeah, sure, they'd write down, verified it, but they weren't truly doing it. And so that was one of the first things that I did when I got here, because being a consultant, I knew that technology was out there.
Yeah, totally. At least eventually the 95% coverage, right?
Yeah, and so and a big piece of that was looking for the right vendor that did the bidirectional communication with our EHR, because we didn't want to partner with somebody that that couldn't do that.
Right.
Really, then you're still looking at another screen for the communication.
Yeah, the difference is a phone call or a screen, right? But like the end result, the data entry problem is all the same.
It's all the same. So that was vital for us, and we were successful in that. We've been using that for about 3.5 years, so it's been wonderful. So
that's great. So talk to me a little bit about, looking ahead to the next year, for other folks who are, in the audience and listening, something for people with a similar role as yours, like what advice would you have or tips and tricks to incorporate like readiness, make sure the patient's prepared into your overall access strategy?
So, if the tips that I would have, if someone's looking to improve their patient readiness process with a digital solution, my advice would be to do your research, make sure that the partner you choose wants to be your partner and here's your vision versus.
I feel like there's a story there behind that comment, but I won't ask it.
Yeah, there is. So,
okay. When we see each other, hopefully in the fall, I'll want to get that one.
Since I've been here, and I won't do it again. So,
okay. So one is make sure you have a partner who wants to be a partner. Got it.
Yep. And then just make it as easy and convenient for your patient as possible to get the information that you need to make the visit. So,
yeah, and a lot of what you've been saying, maybe if I add a third, maybe put a couple of words in your mouth, is actually making it easy on the staff too, right? Because a lot of what you said is around bidirectional integration, making sure the staff is ready, because there's two sides to that coin. So, maybe, taking it as an opportunity to think a little bit and reflect on what you've been sharing with us.
Yeah, for sure. So, making it easier for the staff to do their job, because they're more willing to do it successfully if it's not so convoluted and complex to do, right? Really easy for someone to do it, they're gonna do it a lot easier, and that'll free them up to do other things that need to get accomplished too. So
yeah, no, I love it. I mean, kind of really that big takeaway there is deep integration, partnership capability with whoever you're helping to solve that. And then really making it easy for really, I think it's what you're saying is that all the entities, right? Whether it's patients, providers, staff, administration, it's kind of, I joke, there's no easy button in healthcare, right? There isn't, right? It's not a simple business in life we've chosen, but ultimately, we want to produce these wonderful experiences to make sure our patients are ready to get the great services that you guys offer at Andrews and Permian.
Yeah.
So, Chris, thank you so much for spending a little time with us today on episode 20 of Digital Health on Air. I think you shared some invaluable feedback and invaluable advice with our audience on what does it take to run a clinic that puts patients at the heart of what they do.
Thank you so much for having me. It's been a pleasure to be here.
Love it. And hopefully we'll see you soon in the fall.
All right. Sounds great. Thank you.
Great. Cheers, Chris. Good seeing you.
You too. Bye-bye.